most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course,
Woo
Bob.
woo. Today we're talking about the one simple change to greatly help your spinal stenosis or spondylosis. How do you say, Brad?
Spondylolthesis?
Yeah, spondylolthesis. I don't think I spelled it right on there,
No,
Brad.
you didn't. It's a tough one to spell,
So,
too.
if you have either one of these, they're different, but you're actually going to use the same treatment because they respond to similar. Yeah, they have similar symptoms.
Yeah.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. We're always doing a giveaway. What it is, we don't know because this is a future video.
Video.
So go and check it out. Put it in the comments what the giveaway is. You can also go to Facebook if you belong to that, and it'll be pinned at the top of the page, the contest.
Yeah.
Go to Twitter, Instagram, TikTok, and we're also just starting Zen. So you can check us out for 60-second versions of our program.
I like that name.
All right. Anybody who has spinal stenosis, spondylolthesis, knows that one of the things that bothers them is when you extend your back.
Yes.
And by extending your back, we mean going back like this, or if you're lying on your stomach and you, well, let me show.
Yeah.
We demonstrate everything here. So this too, very bothersome. And it gets to the point where it can progress over time where you actually feel so much better. It's called shopping cart syndrome.
Yep.
Because you lean on the shopping cart, it feels so much better. And I've had many patients that after a while started walking like this.
Oh, yeah. You see that people walk, and usually they're older people typically.
Right, right. So we're trying to prevent that. So one thing that we want to stop is we want to make sure your pelvis is correct.
Right.
Let me just show real quick. So here's your pelvis, and
here, I'll do the tilt, Bob.
Yep, this is normal if it's level, but if it's tilted forward, now the back is actually already extended.
Mm-hmm.
So you're already at you're having to lean forward just to stop extending your back.
Right.
If it's tilted back, now you can easily straighten up further than you could before because you're actually even flexed a little bit.
Right.
So
the idea is we need to figure out how can you change the position of your pelvis, and the way you're going to do that, we'll show you an exercise, strengthen the abdominal muscles and stretch some of the muscles in the back.
While stretching the muscles, the hip flexors.
The hip flexors as
yeah,
well.
The hip flexors will pull you down. Will pull you down like this. See, I'm going to show you an anterior pelvic tilt. I'm tilting down. I should have had tape on here.
Yeah,
Brad.
we should have did that.
Yeah.
Just take your pants off.
No, you can see my pants a little bit here.
Okay.
See how it's tilted forward?
Yep.
Now I'm going to tilt it back.
There you go. Yep.
Okay. So if my hip flexors are tight, can you see how they'll pull me down? And if my abdominal muscles aren't very strong, my core is not very strong, it's not going to help. It's not going to be able to pull them back up.
Yep.
So we're going to show you 4 exercises that will help you do all of those. The first one, we got to stretch those hip flexors out. Brad's going to show it supine.
Yep.
Lying down on the bed, and I'll show it kneeling with a pillow.
Okay. So if you're going to do it lying on your back, you need to do it on a bed. A firmer bed works a little better. You slide your body off to the edge. Your shoulders need to be on so you don't fall off the bed. Take one knee up that's closest on the bed. The other one's going to go off. And I can feel my hip flexor stretch right now. If I do this,
he makes it even, he increases it.
Yeah, and we're just going to hang out, let gravity pull this leg down, and let the stretch go for 15 to 30 seconds.
Very common to have tight hip flexors because we are a sitting society. And when you sit, those muscles shorten up. And to be honest with you, your abdominal muscles probably get weak too when sitting.
Sure.
I mean, you're not doing any strengthening when you're sitting. All right, the other version is actually going down on your knee. I'm always trying to remember which one it's better for me to use this knee, right? You can see.
Yeah,
they can see better.
Yep.
So you can see the stripes in my pants here. I'm standing up nice and tall, and I'm bending forward. I'm really stretching that hip flexor.
Right.
Again, I don't want to go down like this. I want to stay straight.
Right. Yep. And you know, if you're doing this, if you feel some pain in your back, you may be extending a little
You
bit.
may have to lean forward a little bit.
And it all depends on how severe your stenosis is or your spondy.
I've had some people start this, Brad, on the staircase. So
Sure.
they'll hang on to both sides. They'll put the one foot up and they'll just lean forward into it. So
Yeah. Too bad we don't have a staircase, but that would be a step, and you'd hold on to the rails.
and then look how that works really well.
Yeah.
I've had elderly people able to do that one
Safely.
and it's surprising how much they go, oh my God. I mean, they don't have to push very far and it starts hurting because they're very tight in that area. All right, we're gonna demonstrate now. Got your pillow.
Oh,
you're
the
gonna lie
pillow.
flat on your back.
Okay.
And we're gonna show the progression here. And now this is really for beginners. This is if you have a pretty good core already, you probably don't have problems. But this is for someone who's never did any abdominal strengthening. The first thing you want to think about is doing the posterior pelvic tilt. And this is very hard for a lot of people to do.
Yeah.
We give people cues like 1, pull your belly button down to the bed, like you're trying to push it down into the bed. And 2, what really seems to help, if you have something here that you're trying to squish.
Yeah.
So if somebody's hand is here, or if you put like a rolled towel there or something, that you're trying to squish down.
Yeah. And that's what I tell my patients. I'll put my hand under the LSN, squish my hand into the bed, and then they tighten their stomach muscles and things go the way they're supposed to.
So once you got that, now you can start the exercise. So Brad, you were going to do it with this one, right?
Yep.
Okay. So he's bringing this one up. That's all he's doing on the first one.
But while I'm doing that,
he's tightening.
I'm tightening and maintaining the tightness here so that my back is pushing into the bed while I do this.
Yep. And if you're not able to keep that tight and it just gives way, that shows you that you need these exercises because you're very, very weak.
Some people, this is all we have them start out with.
You might start with that for a while. All right, Brad, do it with the other leg too.
Okay, so I'm pushed down here, and then I'm going to lift
No. This is the first one yet. Then you do it with this leg.
Oh, I see. Yeah, do right and left, Mm-hmm.
Yeah. So you're doing both sides.
Yeah.
Hold for like 5 seconds.
Sure.
You don't need to hold much more than that. 3, 4, 5. Yep.
I'll go through a little quicker for the video.
All right, next one. Lift this up. And now you're going to just lift this foot off the bed.
Oh, that's a big difference.
Yep. And then down.
Oh, stomach muscles are working.
Yep. Now that was a little harder, right?
Oh, yeah.
So now do it with this one. Lift.
Yep.
And then lift this one just lift it off the bed.
Yep.
Okay. All right, the third one. Now this one is a little bit of a challenge.
Yeah,
you can lift this one.
Yep.
And now you're going to straighten this knee.
All the while, my back is being pushed into the bed. And so my stomach muscles are really
If you're able to do this one, you're able to maintain this during the day. Yeah. So 5 seconds again. So switch to the other side, Brad. Lift this one and then straighten that one. Yep, you even have to hold on there.
Yeah, it's definitely if you're able to do this, you're fairly good shape.
Yep, you're doing pretty well. But if you get stuck and you can only do the first one, that's fine. Do it for weeks if you need to.
Right.
But I'd like to see these done once a day at least, and do it over time, and you're going to find out you're going to have less pain and be able to straighten up more with either condition.
You'll probably find when you do that, it just feels good on your back while you do it, while you push down and open that.
Now, Brad has spondy, and he's going to show you what he does for his.
Right.
Because now you do a lot of core exercises.
Right,
first.
right.
But we're not going to show that, but you're going to show what he does with the hanging handles.
Well, this adds a little decompression to the...
Yeah, it spreads things apart.
Yeah, which typically feels good. So I'm doing this. I'm going to slowly come down, and you can see I'm walking out with my feet to get some pressure or to take the weight off. And then I'm going to... Can you point out right where it is?
I'm going to show right. I'm going to put my hand like this.
So what I do then is I push my back up against the wall at the belt line right there, and I can just feel that open up in the back. It just feels so good.
So he's doing a pelvic tilt.
Yeah. So I'm pushing in, and I'll hold it like that for 5 or 10 seconds.
Sure.
And then I'll come back. So I'm getting some core strengthening.
You get the compression, get core strengthening, and you're working on the proper pelvic tilt there.
Plus, I got the benefits with this up against the wall, I'm working on my posture upstairs, and I'm working on good shoulder mechanics. It's really a good. I do it in the morning just to wake up. I'll
Sure.
hang, and boy, you get that sluggish morning. So it's just I can't say enough about that exercise. Simple too,
All right. Remember, Brad and I can fix just about anything.
except for
Broken heart, but we're working on
that's
it
right, Bob. We'll continue
diligently.
diligent. Yeah, I took last night off.